Namaste and welcome back to Adiyogam. This gentle session is designed for those with high blood pressure or anxiety. We use props, wall support to promote calm, balance and better circulation. Please practice near a wall and keep your breath soft, and let's begin. Now we're going to start Ardha Uttanasana using the wall support. It's called half forward fold. Face against the wall. Place your hands in line with your chest, or you can also place it in line with your shoulders, and slowly walk back until your hip comes in line with your heel. So don't let your head down. Keep your ears close to the cheeks. Ground your both the feet nice and strong. Stay here. This can also be done using a chair. This Ardha Uttanasana at the wall or using the chair relieves spinal tension, calms the brain without inverting the head. To exit, slowly walk forward and release your hands. To use the chair, you can do the same thing using a chair. Place the chair. If this is too low, you can use 2 blocks on the chair. If this is too low, you can use 2 blocks on the chair. Place your hands. Walk back. Spread your fingers. So don't push your chest down too much. Just keep your hip and your heels in same line. You can take your hands slightly apart. Spread your fingers and rest. The key is to rest in every pose. And slowly walk forward to exit and release. Now we go for Parshvottanasana using the wall support. Or you can also do it with a chair support. Let's try with using wall support. Take 2 steps from the wall. From there, step your right leg back. So again, 2 steps between your feet. So try to align your both the big toes. Place your fingertips on the wall slightly above. Rise your left heel, align your buttocks and walk your hands up higher and allow your body to rest gently. So here very important part is to align your buttocks. So that only helps if you rise your heel. The moment you drop the heel, your hip will be misaligned. So keep your left heel up higher, the back foot heel up higher. Sometimes you might get little cramps on the back leg, especially in the calf muscles. In that case, you can switch your legs and try with the other leg. And you can switch your legs. Bring your left leg forward, right leg back, rise your heel up higher. Align your buttocks. The another variation is using the chair. To exit from the wall, slowly step your right leg forward, release your hands. Take the chair, place it in the front and take 2 blocks. Place your hands on the block, step your right leg back. 2 steps. You can take your leg a little closer. Rise your left heel, align your buttocks. Come upon your fingertips and you can stay here. If it's intense, you can place your hands above the backrest and you can stay here. Or you can place your hands on the block if that feels okay. Rest completely on the block, but the action is coming from the foot. After 2 to 3 minutes, switch your legs. Again, rise your right heel, align your buttocks, rest your hands. To exit the pose, bring your leg forward and come back up. Now we go for Adho Mukha Virasana. For that we need one bolster, one blanket and one cushion. If you don't have cushion, you can also use blocks. If it feels too much intense on your knees, you can also take one more cushion underneath. Okay? So roll the blanket. Spread your knees wider. And before that, you just place it in the front. Rise your buttocks. Place the block or bolster, between your heel and your buttocks. Okay, spread your knees apart, big toes together. Now you take this rolled blanket underneath your belly and your thighs and slowly lean forward. Your space between your eyebrows should be resting on the blanket. And place your hands on the cushion. Spread your fingers wider and then relax and rest here. Sometimes this might feel a little intense on your knees, so you can use cushion or maybe a blanket underneath your knees. In Adho Mukha Virasana, let your torso lay over. In a soft child's pose. Let your head rest completely. Feel your back body expanding with every inhale and let the breath find its rhythm. Like the child, relaxing, resting. To exit the pose, slowly bring your hands beneath your shoulder, press the palm, lift your torso, bring your knees together, remove the bolster, roll onto your any one side and extend your legs and just shake your legs few times. Now we'll do Upavistha Konasana, seated wide leg forward fold. For that we need one chair, one blanket and two blocks. Sit on the block, spread your legs as much as you feel comfortable, wider. If you feel any stress underneath your knees, you can also take the rolled blanket, two more extra blanket and keep it underneath your knees if you feel stress underneath the back of your knees. If you don't feel it, it's totally fine. You can keep this one for your on the chair. So I'll roll this blanket, keep it over the chair. Now, there's one more block behind. Use your hands, press the block, rise your buttocks and then slowly rest your buttocks on the front block. Bring the chair in the front. You can also use this height if you want more height. Take your hands in the front, rest your forehead on the blanket. If this height is too low, you can also use two more blocks underneath your forehead. You can increase the height. Just make sure you're comfortable so that there's a freedom of breath. Eventually, the healing begins. In Upavistha Konasana, make sure you're resting the space between your eyebrow center. When we do forward folds, it soothes your heart and quiet the nervous system. The more longer you hold, the more the benefits you'll experience. To come out of the pose, slowly head up. Remove the blanket and slowly remove the chair and grab your inner thighs one by one, bend your knees and bring your both the knees together, feet together, hug your knees. Now we go for Salamba Sarvangasana using a chair. We need a chair, we need a blanket. It's not necessary, but in case if you feel any pain because of the metal chair, you might feel a little bit hard on the back. So you better use the blanket. And then we need one bolster. And also if you want, you can use two bolster if it's too intense, okay? Sit on a chair from the sideways and slowly place your legs one by one on the top. Now, while going back is really important, so make sure you're not rushing when you go back. Place one hand on the bolster, other hand on the bolster, and slowly drop your hands on the mat and keep sliding your hands down until you rest your shoulder bones on the bolster. Once you rest your shoulder bones on the bolster, extend your legs. Either you can take your hands from the out and hold the chair leg. If you feel comfortable, take your hands from inside and hold the chair legs so that you can feel even more your shoulder bones. Lift your head up, tuck the chin and then slowly drop it down. Option 1, stay here with keeping your legs straight. Option 2, bring your soles of the feet together. Make sure you're resting on the center of your shoulder bones. The Salamba Sarvangasana using a chair is really important. Safe inversions balances hormones and circulations happens gently. Skip if your blood pressure is very high or unmedicated. In that case, you can replace with Viparita Karni, the one which I showed you at the last, placing your legs over a chair, resting on the mat. Or you can also do it against the wall, rising your legs. To exit the pose, release the hands first one by one. Take the hand support, slowly ground your foot on the chair and slide your shoulders forward. All the way slide and rest your legs on the chair. Stay here for a couple of breaths. If the asana what we did, if it's too much intense, you can also go another variation. Place your soles of the feet on a chair and rise your buttocks up. You can also stay, this is another variation if the first one is intense. And then rest your legs on the chair. Stay here for a couple of breaths. And slowly roll onto your any one side. Use your hand support. Come back up. This sequence supports your body's ability to calm, balance and restores from within. Practice it regularly, breathe gently and always listen to your body. Thank you for practicing with me today. If this brought you peace, consider subscribing to our channel and please share it with your friends who may need this gentle care. Namaste.